BioticsAI is a platform used by obstetricians, and it can plug into any ultrasound machine, and it helps detect fetal abnormalities, so pregnancy problems.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with Robhy Bustami, the CEO and co-founder of BioticsAI. Robhy, great to see you.
Awesome, great to be here. Great to see you as well.
I feel like the last time we talked, I was looking at a photo of you holding a giant check. So tell me about what that was.
Yeah, totally. Yeah, so we participated in TechCrunch Disrupt last year in San Francisco, which is the world's largest startup competition. Over 3,000 startups are evaluated. 200 startups make the top 200, and then out of those 200, 20 compete for the top prize. If you're familiar with the show Silicon Valley, that's the show that's the competition in the first season that they win. And we got fortunate enough to get first place.
You got first place out of all of those. Okay, that's amazing. Congratulations. How did that feel?
I was overwhelmed. I mean, I think the biggest thing that we were excited about was the fact that the problems that we're focused on and trying to solve got international attention through that, and a lot of outreach from people that have had problems in terms of pregnancy care or have gone through potential fetal malformation-based conditions that we're trying to solve in terms of diagnostics. So it was great. It was great to see the pouring outreach after, and excited to really leverage that for the next step of the visit.
Okay, so let's unravel it. Let's explain what BioticsAI is and why it resonated with people so much.
Totally, yeah. So BioticsAI is a platform used by obstetricians, and it can plug into any ultrasound machine, and it helps detect fetal abnormalities, so pregnancy problems in ultrasound. The problem that we're solving is today that half of patients with a fetal malformation are misdiagnosed due to errors by ultrasound operators. And when you have this wide spectrum of skill sets in conducting and capturing and interpreting prenatal ultrasound examinations, you end up with a high rate of misdiagnosis because mistakes are. So what our solution does is it mitigates those mistakes and makes sure that every operator is providing quality diagnostics for their patients.
I feel like we have a lot of analogs in other industries of like just AI-assisted imaging. What would be a great comparison to what you're doing?
Totally, yeah. I mean, if you look at like Caption Health, for example, they work within the cardiac space. Very similar in the sense that they're mitigating operator dependency, helping capture ultrasound examinations for the heart, and helping in localizing as anomalies. And we're doing the same, but within the prenatal space and on the fetus and on the mother as well.
What do you think set you apart in the TechCrunch challenge? Obviously, you've got this great problem that you're trying to solve. And obviously, it has to be a mix of the right team and the right product and all these sorts of things. But help us understand what people saw when they voted for you number one.
Right. Yeah, absolutely. I mean, the judges came up to me, the judges came up to me and sort of gave me a little rundown as to why. After the award was announced, yeah, they came up to me and gave me a little rundown. I think two pieces. One was the actual demo. We had a live streaming. We had a volunteer patient. We did a live demo. We had a volunteer patient actually come in. Our chief medical officer actually ran the ultrasound examination, sent it through the system.
Don't they say never do a live demo?
So TechCrunch Disrupt, the thrill behind it is that everyone has to do a live demo.
Oh, wow. Okay.
So in some cases it doesn't work. There's a lot of, so that was really, I think, the thrill behind it. The other piece as well is, I mean, we've validated our technology quite a bit at this point. So we knew that we were going to be able to showcase this and do it quite well. So we were quite confident we were going to have a successful demo in the process. But yeah, that was, I think, a really big piece was we were able to really showcase, everyone could relate to that journey of, going in for an ultrasound, being quite nervous, and then showcasing how our product can really improve the overall quality of that screening. And then the second piece as well was on the Q&A. There was a lot of questions that were asked at that time in terms of, across all of the different people that were competing. And the feedback that we got was that we had a really thorough kind of understanding of every part of our problem, every part of the business model, every part of underlying technologies that helped a lot as well.
Do you get any pushback from OBs or ultrasound technicians about, hey, AI taking over this part of my job or automating a piece that we think should be a human only?
No, I think OBs are aware of the operator dependency problem, and I think they see, especially when you're looking at the head of an MFM division, for example, like they'll they have to manage these ultrasound screenings across a large workforce with a lot of patients coming in. So what we find is they see the value, and we sort of optimize this technology around where they would gain, where the physicians would gain a lot of value. I think the other piece as well is we did take into account some of the areas within the workflow that they mentioned, when they've leveraged past AI products, they weren't a huge fan of. And we made sure that we sort of supplemented the workflow in a way that that works best for the that care. So yeah, I mean, in general, a lot of questions, but once they actually use the technology and the AI, they understand the value, not too much pushback at though.
Shifting gears just a little bit, you had this sort of mountaintop moment with TechCrunch and all what that came from that. But, it's a long slog when you're a startup. I'm sure a couple years prior to that, you weren't sure that you were going to make it to that mountaintop, that particular peak. Take us to a moment where things looked a little bit bleak with the business, or you faced a particular challenge, and just sort of walk us through how you worked through it.
Totally, yeah. I mean, I think one of the core pieces really leading up to TechCrunch was, well, how do we share our story as founders? Or I think a huge component was finding like the right pieces to really showcase, hey, we care about this problem and we want to, we're doing everything we can to really build out this technology that solves the problem. I think that was one piece sort of leading up there and really doing a lot of trial and error to get to that point. And then the other piece as well was sort of educating people on the fact that this is a huge problem. I mean, every time I bring up that half of patients that have a fetal malformation are misdiagnosed, people are shocked. And I bring up that a third of patients get incomplete screenings, they're shocked. So really doing that level of sort of making sure we're breaking down the problem for everyone to understand, because this is a problem that affects everybody, and making sure that they understand how we're trying to solve it. So really, I think in that storytelling and really making sure people understand that's sort of the gravity of the issue.
Yeah, in that vein, help us understand at a really human level what happens when there's a misdiagnosis. Give me some examples of like the downstream impact of that.
Absolutely, yeah. So if a problem isn't captured early enough, there are downstream issues that can happen when it comes to intervention. So it depends. There's a wide spectrum of problems that can occur, right? So there's over 250 different types of fetal syndromes that can occur. But across that spectrum, there could be different conditions that could happen, and that could require intervention, whether that be termination for pregnancy, whether that be prenatal surgery that needs to be done, whether that means of a surgery immediately post-birth needs to be done either on the newborn or on the mother. At the end of the day, everything starts with the ultrasound and making sure that you have accurate diagnostics so you can prepare for whatever intervention can happen down the road. So, and making sure you're capturing these problems early, you can mitigate a lot of maternal morbidity and maternal mortality in process.
Okay. Have you been able to tie any numbers to that? I mean, obviously, how helpful is this down the road in terms of saving lives, maternal mortality? Do you have a sense of the actual efficacy?
Yeah, I mean, absolutely right. So today, a third of patients get incomplete screenings, as I mentioned. So when we're looking at the first initial release of our product, and the number one component that we're actually tackling in terms of misdiagnosis, that's let's make sure patients are getting complete screenings, and that in itself will mitigate a lot of misdiagnosis. And you're looking at the efficacy of our algorithms today. Today we have our accuracy is actually 98% in terms of our reference support, right? So we've actually conducted a clinical study on obstetricians that historically perform cold quality ultrasound scans, and when we integrated our solution into the workflow, the overall completeness rate of their scans went from 70% to 90%. So we validated our technology across a variety of different ultrasound machine manufacturers, different patient subgroups, in addition to actually conducting studies in the workflow to see how we can actually improve the overall diagnostic outcome for this patient.
Interesting. Okay, so what should we be looking for from Biotics in the next year? What's next?
Yeah, so we've all but completed all of our we pretty much completed all of our work for FDA submission, and we're on track for an FDA clearance in Q1 of next year.
Oh wow! Okay,
we're speaking to health systems all over the nation. We're gearing up for a go-to-market and getting ready to
roll out.
Absolutely, yeah.
Fundraising in the next year.
Yeah, so leading up to our FDA clearance, we plan on launching our fundraising round. We closed out a pre-seed earlier this year, and we expect to fundraise so we can scale out and pre-seed.
It's going to be a big year.
Absolutely.
It's awesome. All right. Well, thank you for the update, Robhy. I appreciate it and wish you the best in the next 12 months.
Appreciate it. Thank you so much. Yeah, take care.